Hello, I'm going to go on a talk-through examination for you today of a patient's legs, the motor system examination. David Threlins very kindly agreed to help out make this video, so thank you very much, David. So we start off with the patient lying on the couch, and we'll have a good look at the legs first, inspection. So David's going to look at your legs, okay? So David's wearing a gown, which means we can get a good view of the legs. You want to have a good look at the thigh muscles, and in the clinical setting, you'd want to also have a look at the pelvic girdle as well, which we won't do for the purposes of the video. And you're looking for wasting or for fasciculation, which we don't see in David's muscles. So we're going to check the tone in your legs now, David, okay? So I want you to try and relax. I'll move your legs about, I'll be talking to the camera, okay? So when you're checking tone, it's a good idea to have the patient relaxed. You want to roll the leg first so you can feel the tone of the hip joint, and you'll also be observing the way the ankle moves. There should be a nice, relatively smooth rolling of the ankle as well at the bottom of the leg. Next part of examination of tone is to bring the knee up. You can see the heel staying on the bed. This is a fairly sharp movement, not too fast. Otherwise, a lot of patients may get surprised and the leg will jump off the bed anyway. Next part of the tone exam is to check for clonus at the ankle. So you want the knee in semi-flexed position or slightly flexed, and it's a quick movement of the ankle. And normally a patient would be allowed a couple of beats of clonus. David doesn't have clonus. Okay, that's great. So tone is normal. We're going to examine the power in David's legs now. So David, I'm going to ask you to lift your legs up, bend your knees, that sort of thing. Just try and resist my movements, and I'll explain hopefully clearly as we go along. So first thing we need to do is try and lift up this leg, okay? Push up hard. So you want to get the leg reasonably flexed so you've got good muscle action you can push against. And this leg, testing one side against the other, push down to the bed. And of course, when you're testing hips, the patient is fixed to the bed, essentially, because the weight of their body will fix into the bed. So you don't need to worry too much about fixing across the joints. Bend your knees up now, David, please. Can you push this leg out straight? Okay, now here you need to hold above the knee so you know where the power is coming from. Push and bend your knee this side. Similarly, when you're asking the patient to flex their knees. Great, and straighten your legs out, please. Now, testing at the ankle, I'll test plantar flexion, so push down, David. This side, push down. Test dorsiflexion, bend your ankles back towards your head, David, please. Push back, good. And this one back. And then you can test eversion and inversion on both sides. So push this foot out towards me. Push that foot out towards the camera. Push this foot in towards me. Push this foot in towards the camera. Okay, that's fine. So all the muscle strength is good. We're going to check reflexes now. So using a tendon hammer, we'll check reflexes at the knees, both sides. You want the knees slightly flexed again, and then you can check. David's got very easy elicitable reflexes at the knees. At the ankles, again, I find it easiest to have the ankle in this sort of position, and you want the ankle in a neutral position. So don't overextend it, and don't leave it too plantar flexed. Okay. So you might not see that on the camera. David's ankle reflexes are there, not quite as impressive as his knees. Then you can also check the plantar response. Or you could look, or what you're looking for is an abnormal one, the Babinski response, which is where the toes are upgoing. So we'll check David's. So you're going to take an orange stick and scratch it up the outside of the foot and across the top of the ball of the foot. And what you're looking for is the first movement of the toes, which you can see are down. That's normal. And again on the other side. Okay, that's the reflexes done. So David, thank you very much for helping us with that examination.
Pleasure.